So, doctor, your history chief complaints is that a 6-year-old girl, her mother came to you. Girl name is
Uh-huh.
Sarah. Mother is Amina. Suppose the chief complaints there is a this morning the child is limping. There is painful swollen on the left knee, and also some rash in the body thigh.
Mhm.
So you have to take the focus history from mother.
Limping, painful, knee joint, painful,
Yes, limping. She's limping from this morning.
painful. Okay, limping this morning. Okay. And rash on thigh. Okay, fine.
Mm,
Okay, okay. Give me just 1 minute, huh?
okay.
Okay, shall we start?
Yes, you can start now.
Okay. So, hello, good afternoon. My name is Dr. Fauzi. I'm one of the children doctor in this hospital. I believe I'm talking to Mrs. Amina, mother of 6-year-old Sarah.
Yes, I'm Amina. Sarah is my child.
Thank you so much, Amina, for visiting us. Today, we are going to discuss about Sarah's health condition. During our conversation, I may note down some points. Is that okay with you?
Yes, okay.
Okay, thank you so much. So, Amina, can you please tell me what is your main concern for Sarah's health condition?
You know, Sarah has today morning what happened? She wake from the bed and she's complaining, Mama, I can't work because started pain on the knee joint. I feel, and then at the time I think some rashes. That is the problem.
Mm-hmm. Okay, I'm so sorry to hear that. And tell me that this pain is only on the knee joint, right knee joint?
No, the yes, pain on the right knee joint.
Okay, fine. And is this started suddenly, like in the morning you saw?
Yeah, yeah. This in the morning.
Yeah, okay. Is it becoming more and more, or is at the same intensity?
I think same intensity. That not too much excessive.
Okay, okay. If I give a scale that 1 is least and 10 is worst, where you will keep this pain?
I think 4 to 5.
4 to 5. Okay, fine. Okay. And is there any factor that make it worse, this pain?
No, actually, this morning happened. She's taking rest, and now we are here.
Hmm.
So nothing I notice.
Okay, fine. Nothing. Okay. Okay, tell me about the rash on her thigh. Like, describe the rash for me, please.
What happened? Rash is thigh means in both thigh and also some lower leg. I find some
Uh-huh.
darker rash which are increasing in size. With time and darker.
Right. Uh-huh. Darker. Okay. What is the color of the rash?
Brown, dusty brown.
Okay, brown. Have you pressed this rash?
Yeah, yeah. That is not blanchable. I checked that, but it is not blanchable.
Oh, okay, okay. Is it painful?
No,
Okay. Is it itchy?
no. There is no any itchiness.
No itchiness. Okay, fine. Is there any bleeding from any side or from this rash?
No, there is no any bleeding.
No bleeding. Okay, fine. And what about the other side? Like on the left side, the left knee is okay?
Yeah, knee is okay. There is no pain, but rash present.
Okay, fine. Okay. Is there any fever?
No, there is no any fever right now.
No fever right now. What about her activity as she has this limping and
I told
rash?
you this morning she actually not she's limping. She can't walk, and we are here
Uh-huh.
for that.
Oh, okay, okay. Is there any concern for weight like before this complaint?
No, there is no concern about weight.
Okay, fine. And what about her sleep?
Yeah, sleep is okay, no problem.
Any disturbance? Sleep is
No,
okay, okay. Have you noted any lumps and bumps in her body?
no.
Okay, fine. Okay, now, Amina, I will ask some more questions regarding her other systems, okay?
Hmm.
Okay. Have you noted any problem with her vision or in her eyes? Any redness?
No,
Is there any concern for headache?
no, I don't find there is any headache.
Okay. Okay. Have you noted any abnormal movements in her body?
No,
Okay, fine, fine. And any swelling in front of her neck?
no,
Okay. Any concern for chest pain?
no, I don't find any chest pain.
Okay, fine. Any tummy pain
Yeah, yeah, she has also tummy
or
pain.
tummy?
Last night she told me there is some tummy pain.
Oh, okay. Any tummy swelling?
No,
Okay, fine. What about her poo? Is that okay?
who is okay? I have no any concern.
No concern. Any concern for her pee?
No, I have no any concern about her pee.
Okay. Is there any bleeding from any site in her body?
No, there is no any bleeding any side on body.
Mm. Okay. Have you noted any swelling in her body? Like any body part, like legs or face is with swelling?
No, there is no swelling. I have noticed.
Okay, fine. Okay, thank you. So, Amina, are you like, do you have any concern for her past? Like, are you following any team of doctors for her?
No, I have no any concern, but I want to inform one thing that like 3 weeks before she has
Yes.
some fever present. Um, I don't know there is any relation or not. Otherwise, past means maybe 2 years of age. There is some she admitted in the hospitals for bronchiolitis diagnosis. I
Okay,
don't know there
okay,
is relation or not.
okay, okay. So 2 weeks before this fever, was this associated with any other illness, like any other complaint, like any throat pain, any loose
Yes, yes,
stool?
some throat pain was she drink warm water.
Uh-huh. Oh, okay, okay. Have you taken any help from the GP?
No, I have just given her some paracetamol and it improved.
Uh-huh. Okay, fine. Okay, thank you so much for sharing. Okay, is there any operation done in the past for some
No,
reason?
no,
Any blood transfusion given to her?
no.
Okay, fine. Okay, tell me, like when you was pregnant, how was the pregnancy and how was her birth?
Yeah, it was smooth. Pregnancy was uneventful.
Uh-huh,
We just discharged that day.
uh-huh, uh-huh,
No, nothing.
uh-huh. Okay, fine. Good to know. Okay. Do you have any concern for her development, like her walking, talking, playing? Is that okay?
No, I have no any concern. She's fine, I think.
O- Okay, okay. Has she taken all her jabs?
Yeah, she has taken all the jabs.
Mm, good. Is she allergic to some food or medication?
Allergy? No, I don't think. But she has some allergy in strawberry. If she eats strawberry, some
Uh-huh.
rashes develop. It is very mild.
Oh, mild. Okay, okay, okay. And have you any emergency plan for this rash? Have you discussed it?
No, no, never discussed that much. Not happened.
Oh, okay, fine. Okay. Now tell me about her food and her growth. Like, what about her appetite?
Appetite is normal. Children are. She
Mm-hmm.
likes food. Okay, no problem. I have no any
Okay,
concern
fine.
regarding that.
Okay. Okay. Does GP measure her weight and height?
Yeah, GP measure her weight and height.
And is that okay?
Yeah.
Okay, fine. Okay, thank you. And now tell me, like, is there any other family member with the similar complaint?
No, there is no any family member with the similar condition.
Okay, any other illness in the family?
No.
Okay, okay, good. And describe your home for me, please.
It's a regular home, well aerated. We have three bedrooms.
Hmm.
That's our home.
Okay, okay, fine. And who is earning member in the family?
My husband, he is an engineer. He is the earning member in the family.
Hmm.
9 minutes.
Okay, and okay. And are you satisfied with your earnings? Like, is it sufficient for you?
Yeah, it's okay. Acceptable, you can say that.
Okay, fine. Okay. And does she go to school?
Yeah, she has gone school, but today she missed.
Oh, I'm sorry. How is her school performance?
Okay, no problem.
Okay. And the school environment is okay for her?
Yeah, I have not get any complaint from her.
Okay. How many kids you have?
Yeah, I have another child. She's Natalia. Natalia is a 12-year-old girl.
Okay. Is she fine?
Yeah, I have no any complaint to her.
Okay, fine. Good to know. And so, Mrs. Amina, like, is there anything that you want to discuss? Is there any other problem that you want to share with me?
No, I have not. I just want to my child. What's wrong with her? I want to know.
Yeah, definitely, definitely. We will talk about it. And after discussion with my consultant, I will back to you. And soon we will have a better plan for Sarah. Okay?
Okay. So you have remained 3 minutes. Before 3 minutes, you completed your history. I want to tell you one thing that it is a acute history and also 6-year-old girl. So 6 year there
Yeah,
is no
it is.
puberty history.
Yeah,
Acute history, so you
no
need to take it.
puberty and
No puberty, but birth history, like in term delivery occur, one or two question you ask. Okay. Bullying you directly not ask
mm-hmm.
me. You just school environment is good or not. But you mentioned that is there any bullying? Do you think because MRCPCH doctor they like bullying. Hmm?
Yeah, exactly.
Vaccination any extra jab she has taken or not because it is an acute history you are going. And you ask
Yeah,
about the fever.
yes.
You ask the fever.
Yes, I asked about fever. You told that no, fever was at 2 weeks before and it settled
Mm-hmm.
with paracetamol and did not
Okay,
go
okay.
to
I want
hospital
to
for
tell
that.
you one thing. Any history, when I have to tell you any chief complaint, onset, course, and duration, you ask that when started. Okay. And before, during, after, keep in your
Uh-huh.
mind. Before what happened, during what you do, after that what you do. Because you have discovered this on the past
Okay.
history that 2 weeks before she has some.
Uh-huh.
Okay. In the chief
Hmm.
complaints, if you
Yeah.
history of present analysis, you ask that before anything happened. Okay, some history that is a very big clue
Hmm.
that before. So before, during,
Hmm.
after, when you take the history, keep in your mind. It will be making easy to find out
Yes,
the cause. In the chief
before,
complaints, you can
during,
find
and
out.
after. Yes,
Hmm. And onset course and
yes,
duration,
yes,
what make it
yes.
better?
This is.
Onset course and duration. This duration is
Hmm.
very important.
Hmm.
And also, if there
Yes,
is,
yes.
yes, you do that. Okay, nicely acceptable level. It was organized. So tell me, what is your diagnosis? Describe, present your case
So, okay. Okay, today I
within
have
1 minute.
taken
Please try.
history from Amina. Okay, taken history from Amina. She's 6-year-old girl Sarah. Sarah is with the complaint of right knee joint pain and rash on both his legs from the last one day. And this from the last one day, rash is non-blanchable and painless and not itchy, and the swelling and the swelling in the knee is mild and involving on one knee. There is no association with fever, no weight concern, and it's not affecting her sleep. And she has mild tummy pain um,
mm,
and she has a history of fever 2 weeks before. For that, along with sore throat, and mother gave paracetamol and it settled. Birth history was uneventful. She's developmentally normal. She's and her growth is fine. She has taken all her jabs, and there is no similar illness in the family. And there's no concern for economical issues. And the child has missed today her school.
Putting all together on my top diagnosis is complete.
So, putting all together, my my
It is a case
provisional
of limping
diagnosis,
on
I
top
will
is.
keep
Mm,
yeah, I will keep on the top Hinox-Schönlein purpura, and
mm,
the favoring point is the girl is with limping, is with knee pain, and the rash
mm,
on the thighs, non-blanchable rash. And
mm,
next, I will keep rheumatic fever, because there is a preceding illness of sore throat 2 weeks before, and it can be reactive arthritis, although rash is not for favoring. And I will keep here ITP
mm,
and meningococcemia, although the child is active and has
mm,
no sign of shock,
mm.
and there is no fever.
Okay. And ITP, I
But I
search
will keep it
another
in the
bleeding site, but there is no bleeding, she complains. Right? You ask me.
yeah, there's
ITP.
yeah,
One thing,
yeah.
Henostalen purpura,
So there
important
is
thing, describe the distribution of rash. Is that only whole body or the lower
yeah,
body affected or not? You need to ask me that because I will tell that
distribute
it is the extensor
yes,
choice lower leg and buttock. Okay. I just tell you that do
yeah,
need. That is
distribution
important.
of rash,
This question need
yeah.
to ask.
Yes,
So this is Henostalen
distribution of
purpura. It also
rash.
come on video stations. So suppose video and history both are
Uh,
your covering. So how can you manage this case? First question.
so management is I will, after the history, I will thoroughly examine the child. I will take the vitals, especially I will check the blood pressure, and
Hmm.
will check the urine dipstick at bedside, and will do the
These are the
anthropometric measurement.
hmm, hmm,
I
hmm,
will check the skin examination. I will do the neurological examination and whole
MSK,
abdominal
MSK,
examination.
and
MSK and
musculoskeletal.
musculoskeletal examination and
Good.
abdominal and CNS examination. And
Okay,
after that,
very
I will
good.
go for certain investigation like urine
Hmm,
dipstick. If protein urea is there, then I will check the protein creatinine ratio and urine microscopy and
hmm,
complete blood count to look for to look for anemia and thrombocytopenia. And I will check the CRP, ESR for as inflammatory markers. I will check the urea electrolytes and
hmm,
throat swab, because there was a history of fever 2 weeks before. So throat ASO titer, throat swab,
hmm. So
and
what is
coagulation
CRP
screen
and
also.
ESR? What is CRP and ESR?
C CRP is C-reactive protein, and ESR, erythrocyte sedimentation rate. Both are the
Hmm.
inflammatory, show the inflammation in the body.
Okay, always tell complete blood count or full blood count. Remember this. Hmm? Because
Yes,
they don't
yes,
like
yes, yes,
CBC or
exactly.
FBC. One thing.
Yeah,
Another thing in presentation, what
yes.
happens? You need to keep in mind that is it 1 minute I have to complete the presentation. You are telling she has no birth history,
Huh,
unremarkable.
huh,
There is no vaccination. No need to tell that. Just positive finding nicely and summarize
okay,
it. And another thing in my history, I have mentioned
okay.
you positive finding allergy history. There is strawberry allergy history, but you have not mentioned in the presentations.
Ah,
Right, keep it.
yeah,
And keep
strawberry
allergic
allergy. Yes,
reactions on your DD.
yes.
For the DD, I tell it. And a very nice question you asked
Mm-hmm.
when I told you that she has strawberry allergy. You tell me that do you have any emergency
Huh,
access? Something. Because you have to know
huh,
the
huh,
level
huh,
of
huh.
allergic reactions. Something anaphylaxis happened or not. Hmm?
Yes,
Very nice. Okay.
yes, yes.
Then
Mm-hmm.
this patient investigation you told me. What treatment you give?
Mm-hmm. So here, in case of Henoch-Schönlein purpura, we admit the child. There is certain criteria. If the child has with abdominal pain or arthritis in more than two joint, or protein urea, or
Hmm.
is there is any evidence for bleeding, then we admit the child. And we just monitor the child, monitor the vitals, check the urine dipstick, and treat the complication. If the child has pain, joint pain, as she's with joint pain, so I will give her non-steroidal anti-inflammatory drug, mostly ibuprofen, but I will keep eye on renal involvement because it's a nephrotoxic. And for if she has abdominal pain, again I will give her prednisolone. And if the pain is severe, then I will go for ultrasound abdomen, X-ray abdomen, to rule out intussusception, because this is one of the complication.
Mm. Pancreatitis,
And if there are some
interstitial,
CNS,
spontaneous bowel perforation. Okay.
yeah,
So
yeah,
when you,
pancreatitis as well.
mm,
Yes.
okay, okay. So some indication of admission present, that is orchitis, moderate to severe abdominal pain, arthritis involving more than
Yeah,
two
correct.
joints, proteinuria, clear evidence of
Yes,
gastrointestinal
yes.
bleeding, inability to ambulate. These are. And
Hmm.
investigation, I will
Yes,
not
yes.
admit this patient. This patient no need admissions. Okay. They can ask you, do you admit this
Okay,
patient?
good.
No, I will not admit. Then they will ask that.
Oh,
What are the
okay. Yeah,
criteria of
it is.
indication of admission?
Huh.
So joint pain, you are giving very
Oh,
nice NSAID, ibuprofen first line, use with caution if renal involvement or patient asthmatic. Then abdominal pain, you are giving the prednisolone.
huh.
Renal involvement, not a contraindications. And
Prednisone.
you tell me, very
Huh.
nicely, you tell me everything. So where do you refer this patient, rheumatologist?
Rheumatologist referral is only in one condition: if the rash is involving, is rapidly involving, and and is not responding
Atypical.
to the treatment, na?
If the
Yeah,
rash is
atypical rash,
atypical or
yes.
rapidly
Huh.
evolving. Hmm.
Rapidly
Very good.
involved, then we
Wh-
refer to rheumatologist.
When you refer it nephrologist,
A nephrologist referral if the child is with hypertension, or urine protein creatinine ratio is more than 3 plus. Protein urea is more than 3 plus for 3 days, or the renal
hmm,
functions are not
impaired
proper, like impaired renal functions. And if the urine dipstick, urine analysis showing macroscopic hematuria,
hematuria.
or
Very good.
heavy protein urea. Heavy protein
Okay.
urea, macroscopic hematuria, renal function impaired, hypertension, and
Hmm. Good.
uh,
So we are referring the nephrologist if urinalysis, blood, or early morning protein more than one after 6 months. Then macroscopic
yeah,
hematuria
impaired.
or heavy proteinuria a presentation. Hypertension, significant proteinuria, that is creatinine, urine protein creatinine ratio more than 100 gram per millimole or 3 plus proteinuria
These
for
are
3 days.
the
And
indication
impair
for
renal function. Very good.
referral
Uh,
to nephrologist.
what is the percentage of renal failure in Hennesco in Parpura?
More
Hello?
than one up to three.
1 to 3%, remember. Now tell me, how can you monitor this patient?
Uh, yeah. Hmm.
How can you monitor this patient?
If percentage is very less, like less than 1% go into renal failure. Most of the children, they okay, 1 to 3%. Okay, fine, 1 to 3%.
Yes.
So monitoring is by doing urine dipstick at home, urine dipstick at home, and the blood pressure monitoring every 6 months. Okay,
Mm,
and
mm,
yeah, blood pressure and urine dipstick. Only these two are the
very
measures
good.
we monitor. Blood pressure every 6 months we monitor at GP's clinic, and urine dipstick I'm not sure, every day, or I'm not sure.
Urine district at home until urine is clear. I'm telling you. No, that is uncompleted Hennesco
Okay.
purpura and complicated. Uncomplicated cases, no hospital follow-up required, but GP follow-up 1 to 2 weeks, monthly blood pressure for 6 months, and weekly urine dipstick at home until urine is clear. And Hennesco purpura is hematuria proteinuria, that is
Oh,
complicated case, more than one normal renal function, then as above plus routine follow-up in children's outpatients. And discharge is same. When
okay.
inform the patient may fluctuate several months. Recurrence rate is very rare,
Mm-hmm.
1 to 3%. Seek medical advice if
Mm-hmm.
child develop headache, rectal bleeding, severe abdominal pain. Remember this line. Headache, rectal bleeding, severe abdominal pain.
Mm-hmm.
Okay. So now tell me,
Okay,
your chief
headache,
complaint was
rectal
limping in this
bleeding.
child. Very good. So limping, what are the red flags of limping? Red flags you search in this history.
Red flag for limping are the association with the rash, and a sign of shock, and weight loss, hepatosplenomegaly, lymphadenopathy,
Mm. Okay. So these
and
are
bleeding
child age
from
less
any
than,
side.
for this case, child age is less than 3 years. One, unable to wait BR, totally can't wait. Pseudoparesis, like paralysis develop.
Hmm.
Fever, high grade fever because septic arthritis. It is an acute history. Septic arthritis can be present. Systemically unwell because
Yes.
meningococcemia we are keeping.
Yes.
Lymphadenopathy, hepatosplenomegaly
Yeah.
mentions. Night pain, night sweating. Multiple joint affected. Symptoms
Night
lasting
pain,
more
night.
than 6 weeks.
Yes.
And child age is more than 9 years
Yes.
with
Yes.
pain restricted hip movement. So this question they ask. Normally, Hennescreen purpura, it is easy, but it comes more of the time. That is, it is a very common,
Hmm.
popular for them. It comes as unusual rash,
Hmm.
differential
Hmm.
Hennescreen purpura, like rash complaint. Like our history, come like bumpy rash, and also there is wake up in the morning with painful swelling knee joint, that is limping knee joint.
Hmm.
Another time, also this
Hmm.
history. Okay. And more than 6 weeks, then we GIA, these are. Septic arthritis you can keep on your
Yeah.
DT, because but
Yes.
you tell that is
Yes.
not high grade fever.
But
So this is
rash was like against septic arthritis.
rash is also, and also high grade fever both.
Yes. Yes.
So this
Both.
is two
Yes.
history. Okay.